Right off on a good note this morning. Our first in-studio guest is local psychologist Dr. Amy Beth Taublieb, who is here with an important topic that she has titled, So You Want Psychotherapy, Negotiating the Insurance Maze. And you know, good morning.
Good morning.
It's a great topic because if you do want to make that call and you are going to reach out for help, you kind of don't want to get bad news when it comes to insurance and now what do I have to do, right?
And the other thing too is, let's be blunt. When people call a psychologist, it's not because their life is going beautifully. So the last thing you need, is to have to worry about money. Now, very quickly, two ways to go. Private pay or insurance.
Okay.
People say to me, why the heck would I want to pay out of my own pocket if my insurance covers it? Good question. What you need to know, though, is that most insurance companies reserve the right, if you use insurance to cover the psychological services, they have the right to access your records at any time.
All right.
Some people don't like that idea, and even though insurance covers, they say, never mind, I'm paying out of my own pocket.
Okay.
It's nobody's business.
Yes, okay. I understand that.
If you want to use insurance, few things you've got to figure out. First of all, there are the major insurance plans and the not so major. Just because your clinician participates does not mean you're covered. What you've got to find out, because most of the plans have a whole bunch of subplans, you call up and find out what is your coverage for outpatient therapy with this clinician and give the name. Now, you may hear, yes, you're covered. What does that mean? That can mean a lot of things. First of all, in the worst possible situation, you have what they call a high deductible plan.
Oh, we hate those words.
Oh my goodness. What that means is you have to pay 100% from your own pocket until you've reached the deductible.
Yes.
Well, how much is it, they ask. What you also need to know is that each insurance company sets its own rate. So if you have independent health, for example, you may not be paying the same amount as the lady next to you in the waiting room who has Blue Cross Blue Shield. Those are the high deductible plans. Let's hope you don't. If you do, and you can move on, you say, no, I don't have a high deductible plan. You have to ask, number one, do you need pre-authorization? Not too many plans, but there are still a few out there who say, before we cover, you need advanced authorization. That has to be taken care of. It can be from your primary care, or it can be through the insurance company. You need to find that out.
Okay.
And finally, find out if you have a copay.
Yes.
Copays are very strange amounts.
Yeah.
A lot of the times, copays are not $10 or $15 or $20. Copays can be $7.03. Okay?
It's the weirdest thing.
You need to find out if you have one and what it is. Because insurance companies require that the copays are paid at each session.
Yeah.
We can't bill you for copays.
Right. Well, there you go. I think that's interesting. And again, interesting information, but necessary information you need to know before you can move forward so you know what's ahead of you.
And let
you
me
know how
just
to navigate this. Yeah.
I'm sorry, and let me just throw out, there's an awful lot of information there. And if this is new to you, it sounds very complicated and involved. Anybody, any viewer can call my office, explain their plan to me. I will tell them what it means.
Oh, how nice of you.
Absolutely, even if you don't want to see me, okay?
How could anybody not want to see you?
Imagine that. But seriously, if you have any questions about your plan, you call me at my office.
Okay.
I will answer them for you.
And there's her number, her office number, 834-1505, 834-1505. If you have a comment, though, or a question, and you'd like to get in touch, you can always go to her website, or her email, okay, dramybeth.com. Email is drtaublieb@aol.com. All right, everybody, we still have something very cool for you this segment. We have a 4-pack of tickets to give away to the upcoming 2017 Western New York Boat Show coming up next week at the AdPro Fieldhouse next to the Bills Stadium. If you're interested, you're on a think spring, especially with this forecast, call 644-9840 and caller 7 will win all 4 tickets. Just make sure you have not won anything from us in the past 90 days to be eligible. So call now. Good luck. We'll take a quick break and be right back. Buffalo's Best. Our gorgeous flowers are from Buffalo's Best Flowers. Give them a call or log on to buffalosbestflowers.com. Well, speaking of flowers and roses and hearts, as we have been reminding you all month, February is National Heart Month, and Catholic Health has been providing information all month long on how to prevent and treat heart disease. This morning, we're very happy to have busy cardiologist Dr. Mohan with us this morning to talk more about heart disease and your risk. Dr. Mohan is with the Catholic Health's Trinity Medical Cardiology. Good morning, Doc. Nice to have you here.
Good morning, Linda. Thank you for having me.
Oh, listen, what are the symptoms, if any, of heart disease that you might know that you have this?
Well, heart disease, especially the broken heart syndrome that we're focusing on this month, is actually an entity that is typically brought on by certain emotional triggers, especially in female, or physical trigger in males where they may have undergone a major surgery or severe infection. And what happens is there's a transient decrease in the heart function, almost like you had a major heart attack.
Really?
And The good thing is oftentimes people do recover from the entity and they actually have a full recovery in about a few weeks.
So basically having a big trauma in your life can affect your heart.
Definitely, yeah, definitely.
And that's what you're calling broken heart syndrome. You may not have had any prior issues with your heart. How would you know? I mean, what would the patient feel for something like this?
Now, broken heart syndrome is also known as tachycerebral cardiomyopathy or stress-induced cardiomyopathy. Unfortunately, this is an under-recognized condition and often misdiagnosed as a heart attack, partly because the patients present with chest pain, and even the EKGs and the blood work, they are consistent with having a heart attack. So the treatment is almost as if they're having a heart attack, and when they do an angiogram, which is a procedure to look for blockages in the arteries, that's when you find out there's no major blockages. And that's when you put the two and two together, well, this could be broken heart syndrome. Yeah.
Wow. Could it be fatal?
Well, unfortunately, in few cases, it could be fatal. Realize that the initial hospitalization is almost like a heart attack. You know, you have all the complications of a heart attack. You have heart failure, you have arrhythmias, you have cardiogenic shock, which is, you know, the heart is not able to pump blood to provide the nutrients to the body. So yes, I mean, the initial hospitalization, the fatality is about the same as having a heart attack.
Now you say this could happen to women more than men.
It's interesting. Clearly, it's an under-recognized condition, but we do have data from a large registry that came out recently, and from that registry, it seems like 80% of the patients were females, in the elderly females in the 60s. Yeah.
Now that raises a red flag because we know women's heart problems can sometimes present differently than men's, and here we're talking about for broken heart syndrome, the classic, you know, heart pain, maybe, you know, pain radiating up and down the arm, where for women, you could have a heart attack and feel a nausea, you could feel exhaustion, and you might not link that to a heart issue right away.
Certainly, I guess that complicates the picture because you're dealing with the symptoms that are not classic in female, and then you add on top of the fact that they could also present with broken heart syndrome. I guess in the acute setting, in the initial setting when they present, the treatment is somewhat the same, just like you treat a heart attack. You're better off treating them for a heart attack so that you don't miss the heart attack. And it's only after you undergo the angiogram that you realize, wow, there's no blockage to explain it. And that's when you put everything together. And it's like, well, this could be broken heart.
Could there be a genetic link?
There are some rare cases of genetic links, like generations having the same syndrome, but again, it's not well defined. The other risk factors include, there have been a predisposition in patients with psychiatric disorders like anxiety, depression, or some seizure disorder.
Oh, so again, what we're talking about is we want to recognize heart problems, especially for the month of February. If you believe you are having a heart issue, if you think you have symptoms, if you've looked this up, if you're feeling different, please, by all means, call your doctor because it could be a lifesaver. And ask about something like this, broken heart syndrome. It's real. And if you would also like more information, we have some information right here from Catholic Health at chsbuffalo.org. Doctor, thank you for shedding light on this morning.
Thank you very much, Linda.
Dr. Mohan, thank you.